4018, as you'll recall, there were three key components to that legislation. Some provisions having to do with what happens if a coordinated care organization elects to go out of business and terminate its contract with us. Obviously, that stemmed at the time largely from experience we were all dealing with to one degree or another with the exit of family care from the market. Also dealt with CCO governing board transparency, the idea of what kinds of things that a coordinated care organization does needs to be done in a public setting, and then requirements around social determinants of health. And I'll spend a couple minutes talking about each of those. So first, terminations and transitions. This is just simply the notion that what you did for us and what we further defined in rule was to tighten up the requirements around when we have to provide rates to coordinated care organizations and when they have to tell us that they are going to, if they intend to exit the market, when they need to let us know that to allow for an adequate transition period. You'll recall that we were faced in a family care case with what was conceivably a 0-day transition period that we negotiated at some significant expense to a 30-day transition period due to a lot of hard work by people at the Health Authority, DHS, Health Share, and also family care. We were able actually to pull off that transition in that period of time, but it was far from ideal. So now we're required to have effective notice that allows for an orderly transition, and that is mirrored both in rule and in contract. In terms of governing board transparency, this was the general notion that that while not subjecting coordinated care organizations fully to the public meetings law, there were decisions that they made because they were dealing with significant public dollars that should be made in the light of day and be subject to certain record keeping and the ability for the public to participate. And so we have now we have a rule effective January 1st that makes those meetings open to the public, and basically the rule defines what are substantive decisions, which is the term card that you use statutorily. The idea basically is to call out those things that impact a coordinated care organization's financial risk, the decisions they make that are impacted by or impact the dollars that they use, and to exempt from that public meeting requirement those kinds of things like provider credentialing, personnel decisions, things that similarly would track to the public records law, but without fully implicating the public records law. And if I could get this, go. Maybe I like the end of it, which is social determinants of health. Social determinants of health, really, the implementation of the bill will be intertwined with the implementation of CCO 2.0, the requirements that are part of the Health Policy Board's sets of recommendations around what CCOs need to do to respond to issues of social determinants and health equity. One of the primary requirements in the CCO 2.0 package that will show up in the 2020 contracts has to do with investments and efforts related to housing. Housing cropped up over and over again in in every community, in every context, in every setting, in every service channel as a significant barrier to health and especially to behavioral health. Most encouragingly, I kind of went out to some of these town halls with a fear that everyone was going to look at Medicaid as kind of an ATM to build housing, and no one really was taking that kind of an approach. The bricks and mortar housing people were basically saying, we have resources to go out and do housing, but what we need are either help with services related to that housing, or we need a convening function, or we need a variety of things that CCOs are really well positioned to do. And so we'll require each CCO tailored to its particular region to say something about housing and how it will spend money in that space, as well as deal with other elements specific to that region for social determinants. Let me stop with the House Bill 4018 update and see if anyone's got questions about that.